Take one.
Is it hard for you to say those words, we're trying to cure cancer?
That's a really good question, and why it's hard to say we want to cure cancer. We do. And I think sometimes it's hard actually to think that you might actually succeed.
Patients that we're treating on this clinical trial have absolutely no other options left for them. These are patients who are unfortunately destined to die of their disease, and in a fairly short amount of time.
Emily Whitehead, 554.
So Emma is incredibly matter-of-fact about all of this stuff. This was a child who had had her leukemia come back twice. The parents were looking for a miracle.
What we've learned how to do is train the immune system to recognize and then kill tumor cells.
It's a procedure where we collect their T cells, and they are infected with a virus that will genetically change them so that they will now see and react against their leukemia cells.
And we actually use the HIV virus to do that.
So you're taking the HIV virus and infecting healthy cells with it to help kill cancer?
Yes. The virus has been engineered so that it can't cause disease anymore. But it still retains the ability to reprogram the immune system so that it will now attack cancer cells. We call those modified immune cells serial killer cells. Each infused cell can kill more than 1,000 different tumor cells.
But the reality is the dramatic responses of cancer to new treatments are very unusual. We need to make it clear when we talk to a family that it may not work. Emma was given her T-cell treatment, and within a few days, she was very sick. She had breathing difficulties, she had blood pressure difficulties. We knew that she could not have gotten any sicker without actually dying.
But then a remarkable thing happened. The T cells were growing, they were starting to fight the cancer.
Within hours, Emma's fever disappeared.
It was like the calm after the storm. The clouds went away, and she woke up and there was no leukemia. When that child survived, it was, of course, an amazing event.
First of all, I would say that this whole technology, which has been innovated here in Philadelphia over the last number of decades, truly is not only transformative, I think it's essentially miraculous.
The nirvana in research was curing cancer. I mean, that was a cliche when I was a little boy. And here we are at the doorstep of finding a cure for cancer.
We're finding the keys, and there's always a reason to be hopeful. I was literally told I had about 2 years.
Normally, the job of the immune system is to attack foreign substances like bacteria or viruses. But Dr. June's team has been able to engineer the body's own immune system to go after cancer cells as though they're foreign agents.
To make a new cancer therapy, what we did was program T cells So the cells that are infected by HIV viruses and so on, we program those to become like antibody-based B cells. Those cells then became, after this reprogramming, leukemia-specific killers.
So what Carl's done in his team is to be able to engineer homing devices, molecular homing devices on the surface of your immune cells so they can search out just like a key looking for a lock.
Since it was dealing with altering genetic material, it was like a first taste of a brand new area of medicine. And that alone was intriguing. But I think the thing that made us all sit up and pay attention was these were patients who had tried everything else and had been through everything else, had really no hope, and yet were cured in about 3 weeks.
The third patient we treated was published in the New England Journal of Medicine in 2011. Douglas Olson, who's a scientist and had leukemia for over a decade, and treated here at the University of Pennsylvania by David Porter.
I was diagnosed with cancer in 1996. I was 49 at the time. It was CLL, or chronic lymphocytic leukemia. The prognosis at that point was that the survival rate was somewhere around 6 to 15 years from diagnosis, and there was no cure at that time other than a bone marrow transplant.
Most people can't get a bone marrow transplant, and if they do, a lot of times they have lifelong problems with complications. So I began working on a therapy, doing basic immunology to learn how to grow the T cells. But those T cells come from a donor, someone else. And in our case, we're trying to do it where the patient themselves is a donor.
I really saw it as a way to fight back, frankly, that I wasn't going to be continuing to be a victim of this thing.
They withdraw cells from the patient's bloodstream. They engineer these cells in the laboratory and then reinfuse the cells so that they can attack the cancer as serial killers. And then once the cancer is destroyed, they stay around as sort of a vaccine, should it come back. So it's designing an immune system to treat cancer.
About a week later, I was in David's office, Dr. Porter's office, and we were sitting there and he's looking at me. He said, "Doug, we can't find a cancer cell anywhere in your body." He said, "Your bone marrow is completely clean."
As the immune system eradicated his tumor, he had pounds, literally pounds of tumor, and it went away in less than a week. It was an astonishing event that we saw.
It was at that point I knew that I was going to be okay. It was just, Dr. Porter was just standing there beaming. And
what he said when that happened, when Dr. Porter gave him that news, is he got in the car with his wife and went down to Annapolis and bought a boat.
Medical research doesn't happen overnight. It takes a lot of hard work, and the evolution of Dr. June's work has been a multi-decade process that now is coming to fruition.
Certainly there's been a lot of investment in gene therapy, and as you've seen, things come and go. But in this case, it just happened that everything lined up correctly.
The first child treated, her case was featured on the front page of the New York Times. She had incurable leukemia and multiple relapses, and we gave her just the CAR T cells. And over the period of 17 days, it eradicated pounds of tumor in her case, as well as we'd seen in the adults. And the leukemia was gone. And she's now past 1-year anniversary. I think the public has for a long time wanted cancer to be cured, and so have the scientists. The problem has been that it was a lot more complex than we knew.
I look at this whole thing as a pivotal moment in medicine, really in the history of medicine. If you look at in cancer therapy, we've had surgery, you can remove the cancer. You have radiation that radiates and basically burn the tumors. Or you have chemotherapy that not very specific, kills the cancer cells off in a very toxic way. Well, this is a whole new ball game, which is exploring your immune system, engineering your immune cells to go after the cancer cells, almost a whole new angle on therapy. So it is a game changer. And the fact that it works in a series of diseases now gives us great hope that we can apply it to other diseases and really change the game on how we're dealing with cancer in the future.
Thai scientists led by Professor Dr. Pichet Wiriyachitra have unveiled their significant breakthrough this week, proving that concentrated extracts from mangosteen contain anti-cancer properties. And Kun Orapa Chorprasit has the details for us.
Mangosteens have been cultivated and used as an effective traditional medicine in Thailand for centuries. In 1978, Thai scientific studies showed that mangosteen's rinds helped boost the body's immune system, as well as helping the body fight off viral and bacterial infections. After 35 years of research, Dr. Pichet, chairman and chief executive of Asian Phytoceuticals, disclosed during a press conference on Monday that the beneficial effects of the fruit are due to the substance known as GM1. Doses of GM1 have been proven to be capable of balancing the body's immune system and in turn making it stronger against pain, fever, inflammation, diarrhea, infection, ulcer, and cancer. In 2008, Dr. Pichet led a scientific team at the Mangosteen Research and Development Center, Thailand, to conduct Operation BIM. As a result, the new BIM formula has been prepared using extracts of 5 kinds of Thai fruit and grains claimed to have helped boost the activation of T helper cells, which play an important role in establishing and maximizing the capabilities of the immune system. The company has since been marketing the extracts as part of dietary supplements for cancer patients, as registered with the Food and Drug Administration.
What we have done today is to announce our discovery to the public that the formulation we developed from mangosteen active ingredient, which we call GM1, admixed with ingredient from various other herbs in Thailand, has the ability to increase the amount of T helper cell 17. Now, this T helper 17 has been the landmark of many scientists around the world in trying to clone and produce in a large quantity and introduce it into cancer patients in order to prevent and cure cancer.
Experiments conducted with volunteers have conclusively proven that the patented BIM product significantly increases cancer patients' life expectancy and improves their quality of life. Tests carried out in laboratory and on test subjects in Thailand, as well as in partnering countries such as the US and Italy, have yielded satisfactory results.
What we have shown today is that the quality of life of people under this program has improved greatly. Together with what is going on in Thailand, our colleagues from Italy and also from United States has found the same effect. So the 3 studies have conclusively supporting each other that the quality of life of people who are suffering from cancer definitely is improved, and in some cases, the life expectancy has been increased significantly.
This is Orapa Chorprasit reporting.